I'm Dr. Linda Gromko, and this is Transgender Medicine Made Simple. Today's topic is hair removal basics, and today we're dealing with laser hair removal. As we talked about in our earlier video, laser and electrolysis are the more permanent methods for hair removal. There are many temporary methods. Those include shaving, tweezing, sugaring, threading, chemical hair removal, and epilation, which is a type of mechanical hair removal or pulling out the hairs. And these methods are not to be used for hair removal in preparation for gender-affirming surgery. For surgery, the goal is permanent hair removal, or at least very close to that. Electrolysis is considered permanent hair removal. That is to say that a hair that is successfully removed by electrolysis is gone for good. And today we're going to talk about laser. Laser is termed permanent hair reduction. The patch of skin or hair treated has a greatly reduced number of living follicles, but both electrolysis and laser hair removal can require touch-ups over years to follow. What happens if you don't remove hair before vaginoplasty? The vagina is usually created from scrotal tissue or penile skin. If it is not removed, the hair can continue to grow, and the result is that hair can accumulate in the vagina, resulting in less depth and what's called a foreign body effect, meaning a discharge or odor or possibly a risk of infection. In the slide at the right, you can see that I've removed a clump of hair and lubricant and debris from the vagina of a person who did not have laser hair removal before she had her gender-affirming vaginoplasty. In phalloplasty, the creation of a penis, the skin of the forearm is frequently used to create the new phallus. If the hair is not removed, hair will grow on the phallus itself, or worse, inside the urethra. So these are problems that you don't want to see. We'll have much more on phalloplasty presentations later. If you want even more information, I have detailed presentations on my website for healthcare professionals, and that's at lindagromkomd.com. Laser only works on hair that's brown or black. It doesn't work at all on hair that's white, gray, red, or blonde. If a person has a combination of black, brown, blonde, gray, and white hair, you can start with laser and clear the hair that's brown or black, and then you can finish off with electrolysis for the hair that's left. Here is the Vectis laser that we use in my practice. So there's the machine on the left, and on the right, you can see that there are two different sizes of heads of the Vectis laser, and we use these when treating different areas. So for example, the larger head would be used for something like clearing the chest. The smaller laser would be used for clearing the area over the lip and under the lip, for example. Laser works only on hair that is in the anagen or growth phase of hair development. Hair has three growth phases. The first, and you can see this on the left of this diagram, is called anagen. Anagen is growing hair that is still attached to its blood supply. Catagen is when the hair is detached from the blood supply, and telogen is a resting phase where the hair will fall out. Sometimes you'll see something like clumps of hair falling out, or maybe after childbirth or after major stresses in a person's life, a person will lose a lot of hair all at once. The medical term for that is a telogen effluvium, where you see a lot of hair fall out at once.